Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain syphilis. Infectious diseases can certainly affect the eyes, as the eyes are exposed to the external environment and have extensive vascularization, and also are organs connected to the rest of the body. The eyes are definitely not safe from the infections by external pathogens. Syphilis is a sexually transmitted infection, and it can be staged into primary, secondary, latent, and tertiary. The main presentations are in the dermatologic and ophthalmologic systems. Syphilis is caused by a pathogen named Treponema pallidum, which is a spirochete. Risk factors include unprotected sex, either through oral, general mucosa, or anal contact. And sometimes it can be vertically transmitted, being born to someone diagnosed with infectious syphilis in pregnancy. Symptoms may vary according to the stage of syphilis. In primary, there would be a lot of painless lesions called cankers. They're located intraanally on the oral membranes or on the internal genital tracts. During secondary stages, there may be erythematous rashes all over the body. Fevers and headaches may develop. Mucosal lesions and lymphadenopathy can also be a symptom. Latent stages may last up to a year and beyond. Tertiary stages is where tissue destruction called gumma begins, and it can occur in any organ. Tertiary syphilis has a characteristic sign in the eye named Argyll-Robertson pupil. This presentation of pupils is irregular and small, and this reacts to near as an accommodation reaction, but this pupil does not react or constrict to light. Argyll-Robertson pupil occurs bilaterally but asymmetrically, and this is due to the damage to the central pupillary pathway which extends between the retina to the midbrain, passing through the Edinger-Westphal nucleus. Complications of syphilis include damage to vital organs of the body, all the way from the brain to the heart, vessels and nerves, eyes, liver, as well as bones and joints. And meningitis, stroke, and dementia can also occur as a complication. The differential diagnosis to syphilis presentation includes diabetes mellitus, especially after panretinal photocoagulation treatment, alcoholism, multiple sclerosis, as well as infiltrative diseases like sarcoidosis. Conduct a complete ophthalmic history to get all the details of the patient's presentation, and the slit lamp exam, paying attention to the pupils and the iris. Take a social history as well as sexual history, because syphilis is transmitted sexually. VDRL and FTA absorption tests are done to determine if there are Treponema pallidum in the system, and lumbar puncture can be done to rule out neurosyphilis, or syphilis that has spread to the central nervous system. The treatment of syphilis is with systemic penicillin G, 2.4 million units IV every 4 hours for 10 to 14 days, then 2 to 4 million units intramuscularly every week for 3 weeks are the standard dosing of this medication. If the patient is penicillin allergic, we could opt in for tetracycline injections, and follow serum VDRL to monitor treatment outcomes. This presentation has been an opportunity to explain to you what syphilis is and how this disease relates to both infectious disease and ophthalmology. Now here is a summary slide of everything we talked about. And this is the reference from which we obtained the information of syphilis. Thank you for watching.